Hello, everybody. My name is Alondra Martinez. I am a first-year social welfare student at UAlbany, and today's presentation will be on Black Maternal Health Crisis. So before we dive into Black maternal health in the United States, I think it's important that we first talk about the history of Black birthing people in the United States. So one of the more famous stories here is of Dr. Sims. He is known as the father of gynecology, and he was famously known for developing a surgical procedure that cured vaginal fistula, or VVF, a tear from the bladder to the vagina caused by obstructed labor. Women who suffer from this disorder are incontinent and continuously leak urine. So the way that he was able to develop this procedure was by experimenting on enslaved women. He experimented on them and did procedures to their bodies for the purposes of science, right, to develop a cure for this disorder. He experimented on them for over a span of 4 years, from 1845 to 1849. So why am I telling you this? This is important to know because it's a common theme and pattern in our history to use minority groups, especially Black women, as means for experimentation for things like science, mental health, you name it. So it's important to kind of keep that theme in the back of your head when we're looking at this presentation. Another example was Henrietta Lacks. She was a Black woman, a mother, a wife during the 1950s. She was diagnosed with cervical cancer and went to Johns Hopkins Hospital in Baltimore, Maryland. There, the doctors realized that her cancer cells were remarkable. They had an extraordinary lifespan, and they would reproduce at a quick and impressive manner. So in essence, her cells were immortal. Why was this important, right? So cancer cells normally die pretty quickly, and the fact that they had a cancer cell that was not only living very long, but also reproducing, was a huge, huge discovery to the scientific community. What they later called HeLa cells underpin so much of modern medicine. They have been involved in key discoveries in many fields, including cancer, immunology, and infectious diseases. One of their most recent applications has even been found in research for vaccines against COVID-19. So you might be thinking, what's wrong with that, right? Her cells are great. That's amazing. There's development, and they are helping with so many things and so much science and saving so many lives. And yes, all of that has happened. But with Henrietta, she was never informed of the procedures that were happening. She was never informed of her cells being taken away and looked at for research. In addition to not receiving informed consent from Henrietta, they also continued the use of her cells even after she died. And of course, you can imagine, given all the scientific discovery and everything that was being found from her cells, biotechnology companies profited immensely from her cells. And not 1 cent was ever given back to the family. So you can see why Black communities and communities of color, especially Black women, have a distrust with the medical field given their long history of abuse. So why maternal health? You might be thinking, okay, well, Henrietta Lacks was in the 50s and Dr. Sims was in the 1800s. That is not at all relevant to what is happening today, and that is not at all relevant or relatable to what's happening right now in with our maternal health. The reality is, it is. It's relatable, and I'll show you why. Every day, approximately 800 women die from preventable causes related to pregnancy and childbirth. 99% of these deaths occur in developing countries. The maternal mortality rate for 2020 in the US was 23.8 deaths per 100,000 live births. In 2020, the maternal health mortality rate for Black women was 55.3 deaths per 100,000 live births, 2.9 times the rate compared to white and Hispanic women. Approximately 1 in 3 deaths among women are happening during or within a year of pregnancy were pregnancy related. Pregnancy-related deaths occur during pregnancy, delivery, and up to a year after giving birth and postpartum phase, leading causes of pregnancy-related deaths. So maternal health includes everything from conception to a year after giving birth. Even Black women are still, and Black birthing people are still at risk even after giving birth. So this is just going to show and proving that this is very relevant and it's very prevalent, and it is a big problem, and it is happening today. Many pregnancy-related deaths could have been prevented if doctors made an effort to listen to Black women. Black mothers reported being dismissed by medical professionals when they experienced concerns during childbirth. Tennis superstar Serena Williams told Vogue in 2018 that she could have died after a C-section when she recognized she had a blood clot in her lungs, but had trouble persuading hospital staff to take her concerns seriously. This is a huge concern. She is a powerful woman. She's very wealthy, and yet she was still dismissed by hospital staff. This is very concerning. What about the women that maybe don't have that wealth and maybe don't have that status and power? At the end of the day, it doesn't matter if you're powerful, if you're educated, if you're wealthy. If you're a Black woman, you will still experience these health disparities. College-educated Black women die at higher rates from pregnancy-related causes than white women who didn't finish high school. This statistic was shocking to me. Just again goes to show the deep-rooted issue here is racism. So these are just some personal testimonies on people's experiences with maternal health disparities. So on the left here is a panelist, it's a doctor. In the middle with the white shirt is an actress. And on the left with the orange shirt is a father who lost his partner to maternal health. So I'm just gonna play their videos really quickly.
Than white women. Why is that? What are the factors that are at play here?
Well, we know that Black is a social and political construct. There's no genetic basis of race. So when you see outcomes that are worse for Black people, including maternal health outcomes, we have to look at the social and political causes like racism, classism, and gender oppression. So we know that there are places where Black women show up, like Serena Williams so eloquently talked about, no matter your income, or like my colleagues who are on this call, no matter your income, your education, Black birthing people are 5 times more likely who have an advanced degree to die within a year of childbirth than their white counterparts. So this is not about individual behaviors or choices. This is about racism, institutional, structural racism.
And the next video that I'm gonna play here is the woman in the middle talking about her experience.
Feeling that we had to explain again and again that racism is real And it's very similar to having to explain again and again that, oh, as a birthing person, that you're in pain and not being listened to or believed. You know, you have a group, groups actually, of people who are saying, crying out again and again, we are in pain. There is a problem. Racism is real. Believe us. Believe us.
Charles, you gave heartbreaking testimony about how your wife, Kira, died after giving birth to your second child. What was the fundamental reason that you believe you ended up faced with this tragedy?
It's quite simple. In my wife's case, she was not only in good health, she was in great health. We did everything right. We were extremely diligent all the way down to every single prenatal vitamin. We went to what we thought was supposed to be a top-notch hospital, but it was because of the color of my wife's skin that when we expressed pain, as Tatiana mentioned, when I cried out for help, they allowed her to suffer and bleed internally for more than 10 hours while they did nothing. So I'm clear about the fact, as we sit here today approaching another Mother's Day without my wife, that she would be here with her boys if she was a Caucasian mother.
And Dr. Creer-Perry, most of these deaths are preventable. I mean, we just heard what Charles believes happened with his wife. What are the most immediate things that need to change?
Well, you know, we know that at least 60% of the deaths, according to the CDC, are preventable. And there are things like ensuring that people can go to the providers if they wish. I mean, think about Tatiana's story. She really wanted to have a natural birth. She wanted to be able to labor and not to have a C-section. And so having her voice listened to and heard, but having more access to midwives and doulas and birth centers, and also having the physicians like me, my fellow colleagues in OBGYN, really work on our bias, work on undoing the structural harm that we've learned. We have to unlearn so much harm that we were taught inside of healthcare. So that's what we're doing right now, working with our colleagues to do that.
Here's just one more video of him just kind of explaining more of what he's feeling and going through another Mother's Day without his wife.
Charles, I can only imagine that Mother's Day is a difficult holiday for you. What will you do to celebrate Kira? The photos and videos that I've seen of her, I mean, she's just beautiful, so vibrant. What's it like to celebrate her over this weekend? And how do you talk to your boys about their mother?
Well, I think what we really do is really just do our best to celebrate Kira every day. Kira is very much present in every single thing that we do in our house. There's huge pictures. We tell stories about mommy, but even with all that, it's still very painful. My sons will ask questions about, why can't mommy come home? I want mommy to come home. And so it's difficult. And some things, as a father, you simply just don't have answers to that are adequate. And you just don't have a solution to fix that void. And that's why we're fighting so hard, because even though there's nothing that I can do to bring Kira back and the other mothers that we lost, it's so important that we do everything we can. And we rally our legislators, our advocates, and all these stakeholders to do everything we can to make sure we send other mothers home with their precious babies.
So I know that the panelists mentioned a few things that we will actually be talking about later in the presentation, such as midwives, doulas, policy, right? So that will be coming in the presentation. But something that the doctor mentioned that is very crucial is what can providers do to help eliminate the Black maternal health crisis, right? Because a lot of these things are happening in hospitals. So it's important that we go to the root of the problem. Well, the root of the problem is, of course, racism, but it's important that we go to the hospitals and train the staff. So of course, something that the providers can do is be aware of their implicit bias and be aware of the history of Black birthing people and the medical field and the medical institution, and be aware, and like that panelist said, believe it, believe that it is real, believe that it has happened and that it is happening. That's really the biggest barrier there, because when you are telling a patient that racism isn't true, that what they're feeling isn't true, you're not only providing a space where they can't be themselves or feel that they can come to you with their concerns, but you're also not validating them. And if that was me, I wouldn't feel comfortable expressing my concerns, expressing my questions, and therefore contributing to the things that we don't want, right? We want an open line of communication with the provider and the patient so that we can decrease those preventable maternity morbidity rates. Again, have an open line of communication between you and the provider so that you can provide a safe space to ask these questions. Be open to referring patients to other providers, right? This could be a midwife, this could be a doula, this could be a birthing center. Not every patient's option is a narrow path of hospital birth, hospital route, epidural, C-section, right? If you are a healthy, strong birthing person, then there's no reason, and if you want to have a natural birth, there's no reason for you to not have one. And also, I know that midwives and doulas work with people that have their children in hospitals, right? Just because you go with a doula or a midwife doesn't mean it has to be natural, right? But having a doula and having a midwife does decrease your chances of experiencing infant mortality and maternal mortality. So we got to make sure that we let our patients know about those resources that are available for them. And I will be talking more about that later in the presentation. So this is just an example of a video that I found of a provider that is doing the best that he can to break those barriers and to eliminate the Black maternal health crisis.
How do you think that the health system falls short during a woman's most critical and vulnerable time?
Childbirth in particular, 80 to 90% of the root cause are failures of communication and teamwork. And what that looks like, particularly around racism, is that when Black women express concerns about the way that they're feeling, particularly around pain, the whole health system is slower to respond.
Dr. Shaw is dedicated to finding solutions and says something as simple as a whiteboard and a standard labor assessment that incorporates the patient's input and expertise along with the physician's could save lives. Aisha says she spoke up during her second pregnancy and was diagnosed and treated for gestational diabetes, delivering a healthy baby boy in 2019.
Be your own advocate. Ask the questions. Team up with a doctor that you feel comfortable with because your life depends on it. Your child's life depends on it.
For Good Morning America, Janae Norman, ABC News, New York.
So as I mentioned, I will be talking about midwives and doulas. So what can birthing people do? So if you find that you are in a situation where you become pregnant and you're excited and you want to have a baby, and here are some things that you can do to kind of not be a part of that statistic, or do your best to not be a part of that statistic. So it has been proven through research that having a midwife and a doula decreases your infant mortality rate as well as your maternal mortality rate. And I will go into more detail on that. So just a little bit of background on what a midwife is. A midwife is a healthcare professional who provides an array of healthcare services, including gynecological examinations, contraceptive counseling, prescriptions, labor and delivery care, providing expert care during your labor and delivery and after during your postpartum phase as well, which makes them very unique. They often function as both a quality and economical option for birthing care. And I will talk a little bit about what that means in a second here. Having a midwife reduces use of regional anesthesia, decrease infant mortality rates, decreases risk of preterm birth, decrease third and fourth degree prenatal tears, and many, many more benefits that I couldn't fit on this slide. But again, midwives are healthcare professionals, right? They do all of the medical stuff. So they will check your heart rate, they will do the vaginal examinations, they are the ones that are physically catching your baby. Whereas doulas are trained to provide physical, emotional, and informational support to birthing people during their labor, birth, and immediate postpartum care period as well. So what do I mean when I say physical support? So by physical, I mean that they are physically there, massaging your lower back, walking with you while you're laboring, providing massages, stuff like that. Emotional support, they are coaching you through your birth. They are with you from the moment you begin to labor to the moment the baby is born. And informational support, they are providing information to you from the moment that you hire them, right? So a lot of people hire their doulas from the moment they find out they're pregnant until the moment they give birth, right? So throughout that entire time, they are giving you pamphlets and informations and articles on breastfeeding, on night schedules, on sleep training, on all these different things that can be useful and empowering for someone to have when they are experiencing pregnancy and birth. Yes, so with the support of doulas, many women are able to forego epidurals, avoid cesarean births, and have less stressful births. In addition to also being 4 times less likely to have a low birth weight baby, 2 times less likely to experience a birth complication involving themselves or their baby, and significantly more likely to initiate breastfeeding. So with that being said, given that Black birthing people are the ones that are the most at risk when giving birth, it is crucial for them to have resources like midwives and doulas, because that will allow them to hopefully not be a part of that statistic, that alarming statistic. And that's why more and more Black birthing people are opting out for midwives and doulas as opposed to hospitals. And so I do want to go back to that comment where it said they often function as both a quality and economical option for birthing care. So if you have a child in a hospital, let's say your bill is $40,000, that's a high bill, right? But most insurances will cover that fee quickly and easily, right? Whereas if you are a healthy, strong person and you decide that it is perfectly healthy for you to have a birth with a midwife, a natural birth, if you wish, with a midwife, and they charge you $8,000 or $5,000, depending on what area you're from, right? You will often find that insurances will give you a very difficult time paying for that care. if they pay it at all, right? If they cover it at all. So this is what I mean when I talk about, when we start thinking about what are things that our government can do for us, right? How can our government support Black maternal health, right? How can we eliminate the crisis? Well, one way to eliminate that would be to make sure that these resources are accessible for everybody. Make sure that we have all the options. Make sure that maybe Medicare pays for your midwives and doulas, right? Just as easily as it would for a hospital bill. So what can our elected officials do with our Black maternal health crisis? So here are just a list of policies that are currently active that I encourage your elected officials to look at. If you're an elected official and you're watching right now, I hope that this inspires you and that you are able to help move these bills along. So the first one is the Black Maternal Health Mom Nimbus Act. So what they're doing is that they have a package of 12 bills created to eliminate race disparities. Social Determinants of Moms Act included in a Build Back Better Act. And this is just a quick overview of some of these policies and legislations that are currently in act right now. That again, I encourage anyone that is watching to reach out to their elected official and let them know that these are the current bills that you're interested in and that you want to push for. Write letters, send emails, do a presentation and send it to them in an email, do whatever you can to help move this forward. So the Social Determinants of Mom Act is addressing social determinants of health that affect health, such as housing, nutrition, transportation, and environmental justice. Moms Matter Act is a 2-grant program that addresses maternal mental health and substance abuse with a focus on racial and ethnic community groups. The Kira Johnson Act. This invests in local organizations to train providers like doulas and midwives in addressing discrimination in healthcare, mental health, and more. We all need these trainings, right? Not just medical professionals, everybody that is helping, that is in this realm, right? We could all improve, we can all do better. Perinatal Workforce Act of 2021 grants eligible education programs to grow and diversify prenatal workforce. There is research that states that people that are birthing, that see providers that look like them, have a much positive and much more pleasant experience. Because again, that history that we talked about, right? Of discrimination, of racism, of all the things, right, can be less so if you feel comfortable in the space that you're in, and you can feel comfortable in a space when you feel that you can connect with someone that looks like you. The Impact to Save Moms Act centers Medicare and Medicaid services to establish prenatal care alternative payment models, demonstrating to allow states to test payment models for maternity care, postpartum care under Medicaid and children's health insurance programs. So again, developing programs that are built to have birthing clients and birthing patients succeed in their stories and have them have good experiences and eliminate infant mortality rates and maternal rates as well. So these are some of the things that I encourage people to look at. These are some of the bills that are currently happening right now that can definitely use a push, and hopefully one of them sticks, and we're hoping that movement is happening. And of course, the Maternal Health Pandemic Response Act It's pretty self-explanatory. All of these are aiming towards the bigger goal of Black maternity health crisis and to eliminate it and health disparities among these communities of color. So call to action. So what are some things that our elected officials could do, that you yourself can do, that your mom can do, that your brother can do, that everybody can do, right? So I encourage anyone that is watching to help this crisis by speaking up. So once again, speak to your local elected official to push for legislation regarding maternal health crisis. Feel free to use any of the options I just listed in the previous slide. And also I encourage you to look into the current legislation that is in your area and speak up. Once again, write a letter, meet with them in person, protest, right? All the things, get on the review committees to pass these bills. All those things are good things to keep these bills moving. Donate your time to agencies dedicated to ending the Black maternal health crisis by volunteering and getting involved in policy. Inform yourself on implicit bias if you are a medical professional, and seek guidance from experts in the Black maternal health field. If you're a medical provider, work on breaking down the barriers between the institution of hospitals with doulas and midwives. Sometimes there can be some resistance by providers, by OBGYNs or doctors, in having a midwife present at the birth, or in having a doula present at the birth. Like I just mentioned, there's a lot of research that states that having a midwife and a doula not only makes for a more positive experience, it also makes for a much safer experience, an experience where you don't have to worry about the birthing person dying or the baby dying, and work on breaking down those barriers of hesitation, of doubt. And again, that's just the medical institution telling these providers that these aren't good options for their patients, when in reality they are. So again, if you're a medical provider, educate yourself and help break those barriers down. And of course, donate your money to organizations that are fighting against this crisis. So here are a list of agencies, those experts that I just mentioned in the other slide. Reach out to them and ask for guidance if you yourself want to train your employees and your staff to be better in handling this crisis. If you're a medical professional, or if you yourself are a birth worker, so if you're a doula, if you're a midwife, or if you're a birthing person and want to educate yourself and want to inform yourself on how to be best prepared and how to make sure that you and your baby are safe. So this campaign here, it's called Hear Her Concerns. And as I mentioned earlier in the slides, we talked about how a lot of these deaths, maternal deaths, are preventable, and they're preventable because they could have just been listened to by their provider. So this campaign focuses on hearing her concerns. When she tells you she's in pain, when she tells you that there's something wrong, listen to her. Listen to her when you're a medical provider. Listen to her when you are her significant other. Listen to her when you're the parent. Listen to her when it's a family member, when it's a friend. Just listen. So this is a really great campaign that is saving lives. So I encourage you to look into it. It's a great resource. And the Hear Her Concerns is a global agency, whereas Black Nurses Coalition is right here in Albany. It's a coalition, a group of Black nurses that pride themselves in being nurses and pride themselves in being Black. And their main mission is to eliminate health disparities amongst communities of color, especially Black communities. Also, the Black Mamas Matter Coalition Alliance is a global organization. They have a lot of useful resources on what to do if you're a birthing person and your options, and they have all kinds of summits and all kinds of talks and just information for everybody, for providers, for birthing clients, for birthing workers. It is a really great resource to look into, and I encourage you to look into it because it's a great agency, great program. And finally, I want to thank you for taking the time to listen to me, and I hope that you were able to get something from this presentation, and that I inspired you to go and help fight this crisis. Thank you.